This edema is swelling caused by excess fluid trapped in your body's tissues. Although edema can affect any part of your body, you may notice it more in your hands, arms, feet, ankles, and legs. Edema can be the result of medication, pregnancy, or an underlying disease, often congestive heart failure, kidney disease, or cirrhosis of the liver. Taking medication to remove excess fluid and reducing the amount of salt in your food often relieves edema. When edema is a sign of an underlying disease, the disease itself requires separate treatment. Now let me tell you the symptoms. Signs and symptoms of edema include swelling or puffiness of the tissue directly under your skin, especially in your legs or arms, stretched or shiny skin, skin that retains a dimple, which are pits, after being pressed for several seconds, increased abdominal signs. So these are the symptoms. You should make an appointment to see your doctor if you have swelling, stretched or shiny skin, or skin that retains a dimple after being pressed. That is known as pitting edema. You should see your doctor immediately if you experience shortness of breath, difficulty in breathing, chest pain. These can be the sign of pulmonary edema, which requires prompt treatment. If you have been sitting for a prolonged period, such as on a long flight, and you develop leg pain and swelling that won't go away, call your doctor. Persistent leg pain and swelling can indicate a blood clot deep in your vein, which is known as deep venous thrombosis or DVD. Now let me tell you the causes. Edema occurs when tiny blood vessels in your body, which are known as capillaries, leak fluid. The fluid builds up in surrounding tissues, leading to swelling. Mild cases of edema may result from sitting or staying in one position for too long, eating too much salty food, having premenstrual signs and symptoms, or being pregnant. Edema can also be a side effect of some medication that include high blood pressure medications, non-steroidal anti-inflammatory drugs, steroid drugs, estrogens, certain diabetes medications called thiazolidinones. In some cases, however, edema may be a sign of more serious underlying medical condition. Several diseases and conditions may cause edema that include congestive heart failure. If you have congestive heart failure, one or both of your heart's lower chambers lose their ability to pump blood effectively. As a result, blood can back up in your legs, ankles, and feet, causing edema. Congestive heart failure can also cause swelling in your abdomen. Sometimes this condition can cause fluid to accumulate in your lungs, which is known as pulmonary edema, which can lead to shortness of breath. Cirrhosis. Fluid may accumulate in your abdominal cavities, which is known as ascites, and in your legs as a result of liver damage, which is known as cirrhosis. Kidney disease. When you have kidney disease, extra fluid and sodium in your circulation may cause edema. The edema associated with kidney disease usually occurs in your legs and around your eyes. Kidney damage. Damage to the tiny filtering blood vessels in your kidney can result in nephrotic syndrome. In nephrotic syndrome, declining levels of protein, that is albumin, in your blood can lead to fluid accumulation and edema. Weakness or damage to veins in your legs. If you have chronic venous insufficiency, the one-way wall in your leg veins are weakened or damaged, which allows blood to pool in your leg veins and cause swelling. Sudden onset of swelling in one leg accompanied by pain in your calf muscles can be due to a blood clot, which is known as deep venous thrombosis or DVT, in one of your leg veins. If this occurs, you should seek medical help immediately. Another condition could be inadequate lymphatic system. Your body's lymphatic system helps clear excess fluid from tissues. If this system is damaged, for example, by cancer surgery, the lymph nodes and lymph vessels draining an area may not work correctly, and edema can occur. Another cause could be severe long-term protein deficiency. An extreme lack of protein in your diet over a long period of time can lead to fluid accumulation and edema. Now coming to the risk factors. If you are pregnant, your body retains more sodium and water than usual due to the fluid needed by the fetus and placenta. This can increase your risk of developing edema. Your risk of edema may be increased if you take certain medications, including high blood pressure medications, non-steroidal anti-inflammatory drugs, steroid drugs, estrogens, certain diabetes medications called thiazolidinones. A chronic illness such as congestive heart failure or liver or kidney disease can increase your risk of edema. Also, surgery can sometimes obstruct a lymph node, leading to swelling in an arm or leg, usually on just one side. Now let me tell you the complication. If left untreated, edema can cause increasingly painful swelling, difficulty walking, stiffness, stretched skin which can become itchy and uncomfortable, increased risk of infection in the swollen area, scarring between layers of tissue, decreased blood circulation, decreased elasticity of arteries, veins, joints and muscles, increased risk of skin ulcers. Now coming to the diagnosis. To understand what might be causing your edema, your doctor will first perform a physical exam and ask you questions about your medical history. This information is often enough to determine the underlying cause of your edema. In some cases, X-rays, ultrasound exams, magnetic resonance imaging, blood test or urine analysis may be necessary. Now coming to the treatment. Mild edema usually goes away on its own, particularly if you help things along by raising the affected limb higher than your heart. More severe edema may be treated with drugs that help your body expel excess fluid in the form of urine, which are known as diuretics. One of the most common diuretics is furosemide, which comes with the name of Lasix. However, your doctor will determine whether these type of medications are a good option for you based on your personal medical history. Long-term management typically focuses on treating the underlying cause of the swelling. If edema occurs as a result of medication use, your doctor may adjust your prescription or check for an alternative medication that does not cause edema. Now let me tell you some lifestyle and home remedies for this. These may help decrease edema and keep it from coming back. Before trying these self-care techniques, you should talk to your doctor about which ones are right for you. First is movement. Moving and using the muscles in the part of your body affected by edema, especially your legs, may help pump the excess fluid back toward your heart. You should ask your doctor about exercises you can do that may reduce swelling. Elevation. Hold the swollen part of your body above the level of your heart several times a day. In some cases, elevating the affected body part while you sleep may be helpful. Massage. Stroking the affected area towards your heart using firm but not painful pressure may help move the excess fluid out of that area. Compression. If one of your limbs is affected by edema, your doctor may recommend you wear compression stockings, sleeves or gloves, usually worn after your swelling has gone down, to prevent further swelling from occurring. Okay. These garments keep pressure on your limbs to prevent fluid from collecting in the tissue. Protection. Keep the affected areas clean, moisturized and free from injury. Dry, cracked skin is more prone to scrapes, cuts and infection. Always wear protection on your feet if that is where the swelling typically occurs. Reduced salt intake. You should follow your doctor's suggestions about limiting how much salt you consume. Salt can increase fluid retention and worsen edema. So reducing salt as advised by doctor may help you to relieve edema.